Okay, welcome back, everyone. Hope, as we said, out by Seattle. She headed out to Microsoft's campus in Washington State, and she was joined by the company's VP of Microsoft Philanthropy to talk about the company's efforts in the healthcare business. Let's take a look.
I'm here with Mary Snapp. She's the head of global philanthropies for Microsoft. And we're here with Johnson Breilh. She's the director of advancement for Medical Teams International. So good to have you guys here today. And thank you for inviting us. Cindy, I want to start with you. Explain where we are right now and what Medical Teams International does.
Thanks, Hope. Medical Teams International provides health care for people in crisis in difficult places. Right now we're sitting in our Redmond warehouse in an exhibit showing our story of our work in Uganda, which is the partnership we have with Microsoft, caring for refugees, especially from South Sudan.
And what's Microsoft doing specifically to help you?
Microsoft has provided cloud services for us to enable us to take data and be able to see it immediately versus what in the old system, the paper that I have here, we used to have to wait a month before we got results back from our data or could look at it. It makes a tremendous difference for our clinicians and for all of our staff.
And Mary, how did this partnership come about?
Well, we, about a year or so ago, offered Azure, which is a cloud service, to enable people to put data in the cloud and then to analyze the data. And medical teams came to us with a proposal, and we looked at it and knew right away it was something that we wanted to invest in. We could have a great impact with the cloud services that we could provide to this organization.
Yeah, and Cindy has some paperwork here. So this is what they would have to fill out manually. And now the cloud services team has also developed apps so that it's not a manual process and it's a lot easier on the ground.
Right, so it's more than just providing the cloud service. In this case, we actually provided some implementation support and help too, so that they could deploy it really efficiently and quickly.
And Cindy, in the past year, what's the progress been like?
We have implemented in 7 clinics. We have 40 clinicians now using this and just finding it to be amazing. That's about we're going to have about 1 million records now from all of this data, and we hope to, as funding allows, expand to 48 different clinics. We'll have, well, more than triple the number of clinicians using the service, and it's really changed the way we can actually get feedback to our clinicians as well.
In what ways?
Well, because we can get immediate feedback, let me just explain one thing. We were noticing that a lot of our clinicians were marking other as a diagnosis. Now, when you're a sick person, other isn't a very helpful diagnosis. And prior to this, on the manual system, we would never know that this is what they were doing. Now we have immediate feedback. We can go back to the clinicians and say, what does this other mean? Do you not know how to use the technology, or is it something you've not seen before? Why do you have other? So that would be one example.
And Mary, when you hear about the progress, what does that mean for your services in general?
Well, we're really excited about the services we can offer. And over the last 2 years, we've offered about $1 billion in cloud services to 90,000 nonprofits. So Medical Teams is just one example, and we're so excited to be working with them. But there are many, many other ways in which we can think about deploying cloud services to nonprofits all over the world.
Yeah, and you've said that you've wanted to double this number or even triple it in the next coming years. How do you plan on doing that? What does that mean? Does it mean also giving money as well, or only these technologies?
It's both. So we have created a Tech for Social Impact team in the last little bit. You can find them on Microsoft.com, WAC Nonprofits. And our goal is to double the number of nonprofits that we can address and directly serve over the next couple of years.
Now, how do you choose the organizations that you work with and the causes that you work with? You know, unfortunately, this year we've seen so many natural disasters domestically, but also internationally, on the political front, but also again on the natural disaster side. So you must have to deal with the influx of these requests, and then how do you prioritize and select how you give back?
Well, we do. We really focus on a couple of strategic investments. We really focus on areas where we think we can add unique value. So if we can provide digital skills so that people can get more skills around the world using technology, we're really focusing on the future of work and what some are calling career pathways around the world. And that's in response to a lot of what we've heard over the last couple of years. We're focused on building out nonprofits so that they can do their job better And we're focused on building out our employee engagement program. So in terms of our investments, we invest in those areas, including in the humanitarian space, because the digital skills are really important, and building out nonprofit capacity is really, really important. But we also have a website where any 501c3, which is a nonprofit, can come to the website and take advantage of and license Microsoft technology.
What's the most requested service right now?
Right now, it's Office 365, which is in the cloud, of course.
Yeah.
And so we're really excited about that. We'd love to have more nonprofits use Azure because we think there's lots more that nonprofits can do.
And why is this beneficial to Microsoft's bottom line?
Well, we care a lot about being able to ensure that every person and organization on the planet achieves more. That's part of the mission. We also know that it's something both our shareholders and our employees want us to do. The days are gone where a corporation merely goes to the bottom line. We think it's important, it's really table stakes and more for us to make an impact in the world.
And Cindy, in these areas like Uganda, connectivity is sometimes an issue as well. Is Microsoft helping you with that, or do you have to go to other places to get connectivity on top of obviously having to access the cloud, which is the internet?
Yeah, that's a great question, and we do have problems with connectivity, but we're all part of consortiums and gatherings that are trying to deal with this, and Microsoft is definitely a part of that, and we're trying to really work together, nonprofits and for-profit agencies, to solve these problems.
And when you're on the ground, what is the greatest need there? Is it connectivity? Is it more manpower? Is it donations? Or is it, these digital services?
I'd say all of the above. Funding is a limiting factor for us, definitely. But connectivity is an issue, especially in the places where we'd like to expand this project. The more data we have, the better off we're going to be. We actually feel like we're going to significantly provide information to the global health community with this data, potentially in pandemic surveillance and warning systems. We've got people very interested in this. We just need to expand it, make it bigger.
Right, and we were walking around earlier, you took me on a tour, and you said that last year you raised about $20 million for your organizations, or around that number, and then $50 million coming in from just donations and goods. How much of that is now digital versus physical goods?
Mostly physical goods, mostly medical and health supplies right now. Yeah.
And would you say that in the future that might change, or how do you actually, examine on your books itself, like what you need?
Well, I would say our needs are more and more digital. And one of the things, our employees in Uganda, for an example, where we have 1,400 healthcare employees, they are very anxious to come into the digital age. They are pushing us to provide this. It is job satisfaction for them to have these tablets and to be working from this. They're working in difficult environments. They love it. And it's so helpful. It's so fun to see these young Ugandans be so excited about digital technology. And then on the other side, our clients, our patients, they walk into a clinic and they see these professionals working with digital technology and they go, oh, this is probably good healthcare.
It's the real thing.
Yeah.
All right, well, ladies, thank you so much for joining me this morning.
Thank you.
Thanks, Hope.